WeJoint Plus, a step further in the support of the joint function. The joint surfaces are covered with cartilage, which is responsible for shock absorption, facilitates slipping and is essential for long bone formation and growth. The cartilage is composed by chondrocytes and the extracellular matrix. Chondrocytes are responsible for producing the components of cartilage, such as matrix proteoglycans and type II collagen, the main structural protein in the cartilage. The joint pathology has a high incidence in dogs and cats. There are several factors, genetic, traumatic, degenerative and immune, that can lead to its onset and evolution. Once the inflammation is established, the inflammatory mediators and the enzymes released, collagenase, have a negative effect on the cartilage, reducing the production of structural components and promoting degradation, namely the immune response against endogenous type II collagen. This process leads to the loss of joint mobility as well as to high levels of pain. It is essential to break this cycle of degradation and inflammation, as well as to control pain, giving the animal a better quality of life. A correct approach, whether it is preventive or therapeutic, allows the recovery of the quality of life and prevents the development of a joint pathology. WeJoint Plus combines the action of multiple components and guarantees joint reinforcement, joint regeneration, pain control, control of inflammation. WeJoint Plus uses B2 Cool, supplying native type II collagen. The production and extraction strictly controlled ensures that type II collagen maintains its native form, maintaining its biological activity. This molecule triggers an immunomediated mechanism of action called oral tolerance and aims to reduce the immune response against endogenous type II collagen, a substance similar to that previously administered. When native type II collagen is taken orally, it passes the stomach without being denatured until reaching Peyer's patches in the small intestine. In Peyer's patches, native type II collagen is identified by the immune cells and binds to them. These immune cells then present the information to the T regulator cells, which will release the mediators IL-10 and TGF-beta. These mediators will inhibit the immune response of macrophages against endogenous type II collagen by reducing the release of collagenase and by stimulating the chondrocytes to produce new collagen. But, WeJoint Plus contains even more essential ingredients. Krill oil is the most pure and bioactive source of essential fatty acids, omega-3, with improved action in the control and expression of several mediators, and with an anti-inflammatory and analgesic effect. Glucosamine hydrochloride and chondroitin, imperative for the synthesis of glycosaminoglycans, components of the cartilage and synovial fluid. Herpagophytum procumbens, a new standardized purified extract with anti-inflammatory and analgesic properties, and specifically inhibit COX-2 but not COX-1, which may explain its high tolerance and reduced side effects. Vitamin C, MSM, manganese and zinc sulfate, essential substances in antioxidant processes and in several enzymatic processes of joint protection and synthesis. WeJoint Plus, a step further in the support of the joint function.